Hi everybody, Two Tip Tuesday, Dr. Bryton here, doing an off-site shoot. We are at Spectrum Health, patiently awaiting the arrival of our fourth child. So today, what better than to discuss baby teeth? So we get a lot of questions regarding baby teeth, and so I want to address a couple of them. First and foremost, we'll talk about when they develop and where they develop, and then we'll also talk about things you can do to maybe help your baby or young toddler along as they develop those teeth. So first things first, you'll start to see your two lower teeth, the two front teeth, develop before anything else, and that usually is going to happen around the 6 to 10 month mark. And then within a few months, you'll start to see the top two front teeth, and then you'll see the top two teeth just off center, and then you go back down to the bottom, and you see the top two teeth off center there. And then from there, you'll start to see the upper eye teeth or canines, and then you'll see the lower eye teeth or canines. And then from there, you'll start to see them move backwards on top and then bottom, and then further back on the bottom, and then all the way to the back on the top. And that's the process with those bottom and top teeth happening around kind of that 2-year mark, a little bit after, maybe 2.5 years old. But for all of them, there's a little bit of a window. And so protocol, as we recommend, and the American Dental Association recommends as well, is that you have your baby seen within 6 months of the first tooth developing or coming into the mouth. As well, from there, if they don't develop, as well as being seen at the latest by 12 months time. Because if they're not developing, we want to check them out and make sure that everything is going okay. So that's kind of the developmental patterns. We get a lot of questions about that, so hopefully that helps you. Again, the bottom two teeth and then the top two center teeth, those are the first ones to start around the 6 to 10 month mark, and then kind of from there as the months go along. But then from there, we get a lot of questions about how do we help the children along with that, because it can be quite irritable during those times, and so what can we do to make it a little more comfortable? So a couple things that I recommend. First things first, we have good success with the frozen toys that you can put into freezers and reuse. They're chewable, it's cold, it feels really good. Cold is usually really, really helpful. From there, we in our family have good success with these little mesh nets that you can put frozen fruit into, and they can chew on those and gnaw on those. It can be really, really helpful. And then as always, kids Motrin is really, really helpful. You can talk to your pediatrician along the way too, and kind of see how things are going with that route. Just make sure that everything is comfortable for the child, and give us a call if you need anything. But those are a couple of things that we get a lot of questions about, tooth development and then how to help your baby get through those things. So hopefully that's a little helpful for you. We're going to keep waiting patiently here. We'll keep everybody updated. But we are pretty excited here at Spectrum Health, getting ready. So hope you have a great rest of your night. Hope you have a great rest of your week. Thanks so much.